Hi guys, my name is Tiffany and our presentation is on hearing loss. My group members will introduce themselves as they appear. A hearing loss is a partial or complete loss of ability to detect or understand sound as a result of damage to ear structures. There are 4 types of hearing loss: conductive, sensorineural, mixed, or central auditory processing disorder, also known as CAPD, and also known by many other names. While a conductive hearing loss is problems with the outer ear or middle ear, a sensorineural hearing loss is problems with the inner ear, including the cochlea and the auditory nerve, sending signals to the brain. While conductive hearing loss is usually temporary and repairable with surgery, sensorineural is usually irreparable. Common causes for a conductive hearing loss is otitis media, or a middle ear infection, or otosclerosis, an abnormal bone growth in the outer or middle ear. Causes for a sensorineural loss are a bit different. They can include noise-induced hearing loss, presbycusis, or age-related hearing loss, or drug exposure. A mixed hearing loss is having both a sensorineural hearing loss as well as a conductive hearing loss. So the causes would be a mix of both. A central auditory processing disorder, also known as CAPD, is an issue with the processing centers in the brain, not depicted in the image, but causes can be pregnancy complications, neurological disorders, disease, or damage, such as head trauma or a stroke. A few risk factors that can lead to damage or loss of nerve cells in the inner ear can be heredity. Your genes can make you more susceptible to noise-induced hearing loss or presbycusis. It could be pregnancy complications such as low birth weight or prenatal drug exposure. It could be aging or the natural deterioration of all organs in the body, including your ears. It could be occupational noises, such as working in a work environment with loud noises, such as working in a factory or construction site. There are also recreational noises that can cause hearing loss, such as explosive noises, such as firearms, that can cause permanent hearing loss, and more common occurring recreational noises, such as listening to loud music or carpentry. There are also some medications that have hearing loss side effects, such as certain antibiotics or certain chemotherapy drugs. Some illnesses that result in high fever can also damage the inner ear, such as meningitis. About 5 of every 1,000 babies is born with a hearing loss, and as much as 75% of class discussions can be missed in children with just a moderate hearing loss in one or both ears. 15% of children between the ages 6 and 19 have a measurable hearing loss in one or both ears. A few signs to look out for in babies is if they don't startle at loud noises, if they don't turn their head at the source of a sound after 6 months, if they don't say single words such as mama or dada by the age of 1, if they turn their head when they see you but not when their name is called, or if it seems like they're hearing some sounds but not others. A few signs to look for in children is if their speech is delayed or not clear, if they don't follow directions, or if they often say huh, if they turn up the volume too high. A few of these can be mistaken for not paying attention or just ignoring, but it could be a result of a partial or complete hearing loss. A few signs and symptoms of hearing loss in adults, or also to look for in yourself, is muffling of speech or other sounds, difficulty understanding words, especially against background noise or in a crowd, trouble hearing consonants, or frequently asking others to speak more loudly, slowly, or clearly, withdrawal from conversation, or avoidance of some social settings.
Hello, my name is Jake Greenway, and I'm here to talk about the effects in communication due to hearing loss for children and adults. Hearing loss is a very individual experience, and how the individual copes can depend on a great many factors. Some of these factors do include late versus early onset, the progressive nature of the hearing loss, the severity of the hearing loss, communication demands for school or work, and the personality type. Risk factors for adults later on in life, though, include depression, anxiety, and psychosocial disorders. And this is due to the sheer isolation that happens when you can't converse with your friends or family. Another strong link has been found between the degree of hearing loss and the development of dementia. Dr. Franklin at Johns Hopkins University has found a strong correlation between mild hearing loss and a 2 times likelihood of developing dementia. Moderate hearing loss is 3 times as likely, and then a severe hearing loss is almost up to 5 times as likely. Hearing loss is often comorbid with cognitive and memory disorders as seen with dementia. For children, on the other hand, it is very important to catch hearing loss early so that it does not affect their social or academic life. The hearing loss can result in delays in development of receptive and expressive communication for children. And this is very vital because those are very important aspects that need to be touched upon before exiting school. Language deficits cause learning problems that can result in reduced academic achievement, although it's out of the children's control entirely. Communication difficulties often lead to social isolation and poor self-concept, as we've seen with the adults, and it also might have an impact on future vocational choices. Now we're going to discuss hearing loss factors that influence speech and language development. All children develop differently, and certainly when it comes to speech and language, but there are strong other developmental reasons that can play a huge role in how your child develops communication. These factors include the age of identification of the hearing loss, family involvement and support with the hearing loss, the type and degree of hearing loss, the consistency of using the device, such as a hearing aid or cochlear implant, the age of amplification, types of treatment, cognitive, motor, and social skills, and other medical conditions. There are many speech and language challenges for children with hearing loss within the school system. Some of these do include paying attention and controlling their own behavior, following conversation with multiple people, making friends and interacting with peers, listening and learning in the classroom, learning to read, hearing and understanding sounds around them, making speech sounds, learning new words, putting words together in sentences, using correct grammar, effectively expressing themselves, understanding speech from one another, and following directions in a quiet and noisy place. These are all very important factors when dealing with children in the school system. And if a child with hearing loss can't understand or comprehend most, or if not any of these, it's going to be very hard for them to get along with their peers. What can caregivers and SLPs do? Well, collaboration with as many professionals as possible has been shown to increase success with all types of hearing losses. These can include participation with SLPs, audiologists, hearing instrument specialists, teachers, nurses, and anybody else that is very close with the child. Active participation amongst parents or caretakers is very important as well. Improving conversation and improving the frequency that you talk with them can also very much impact the success that which you have with your child. Clarification of questions and procedures, keeping noises down to a minimum, keeping your child's attention before you speak, and then reading books daily to improve vocab and language.
My name is Julia Costanza, and in my section, I will be talking about hearing screenings and evaluations. The American Association of Pediatrics recommends hearing screenings for all newborns by 1 month of age, or ideally before infants go home from the hospital. 2 screening evaluations that are used for infants are auditory brainstem response and an autoacoustic emissions test. Auditory brainstem response indicates the health of the cochlea and auditory pathways within the central nervous system. Electrodes are placed on the head and in front of the ears and then connected to a computer. Sounds are then played through headphones while electrodes measure brain activity in response to those sounds. It is often evaluated while the client is asleep and is mostly used for babies, young children, and other individuals that cannot perform hearing tests that require attention and response. Autoacoustic emissions are sounds that are emitted by hair cells in the cochlea when they vibrate. An OAE test determines the health of the cochlea by measuring these sounds. A small probe is placed in the ear and sound is presented. Healthy ears will produce OAEs that will be recorded by the probe, and failure to record these OAEs can indicate a cochlear pathology or blockage in the outer or middle ear. Other types of hearing assessments include pure tone audiometry, tympanometry, and speech audiometry. Pure tone audiometry measures the function of the outer, middle, and inner ear by delivering pure tone signals by air and bone conduction. The softest decibel at which an individual hears a tone at a given frequency is called the hearing threshold. Hearing thresholds for each frequency assessed are plotted on an audiogram. Tympanometry measures compliance of the tympanic membrane in response to air pressure. Findings are then depicted on a tympanogram, and results provide information about middle ear function and detect possible conditions and diseases of the middle ear. Speech audiometry measures an individual's ability to hear and understand speech, and it includes speech reception threshold and speech recognition. The speech reception threshold is the lowest decibel at which a client can correctly identify a list of two-syllable words 50% of the time. Speech recognition is the client's ability to recognize words. Hearing assessments are done by audiologists, but speech-language pathologists must have basic understanding on how to interpret and apply results to individual clients. If an infant passes the initial hearing screening, that does not mean they cannot develop a hearing loss later on. Even if the baby passes the initial hearing screening, the AAP recommends that the child be screened again at ages 4, 5, 6, 8, and 10. Additional screenings are also recommended sometime between the ages of 11 to 14, 15 to 17, 18 to 21, or anytime there's concern. The more frequently tests are administered, the earlier hearing loss can be detected and interventions can begin, helping the child to reach their full potential. The first one is, what are some misconceptions about hearing loss?
Ooh, I would say some misconceptions about hearing loss are that it's not a big deal. And that another one would be, I would say that I think people sometimes think that they don't have a hearing problem if they can hear certain things. So a lot of times hearing loss starts in the high frequency range, which will affect clarity, and people have to work harder to understand. When it's noisy, they might struggle, but sometimes people don't think of that as hearing loss.
What can be done in our everyday lives to minimize the risk or prevent hearing loss?
Using hearing protection when doing things that are real loud, trying to limit how loud we listen to music for people who listen to music a lot. I think in general, overall, we could use better education about hearing loss and risk factors of hearing loss. And I really think people should get their hearing checked more regularly, even when they're not experiencing any kind of problem, just to establish a baseline and monitor it because it changes so gradually.
So what populations do you primarily work with?
At the place where I work, we work with adults mostly. We have a couple peds, but very few.
So kind of bouncing off of services, do you find that there's any like communication problems associated with hearing loss, and would you ever refer that person to a speech path?
We don't see that very often. Typically by the time people come to us, they've already, they're usually adults. So if that was an issue, they've already gone through that. I'm thinking about the handful of peds that I've had, and they had all already been evaluated by, SLPs. Most of them were getting services through school. And most of them had an educational audiologist that they were working with in the classroom too. So I have, in those situations, communicated with the educational audiologist directly, if necessary, if there were things we were working on.
Mm-hmm. And the last question is, what can family and friends do to support someone they know with a hearing loss?
So I would say go with them to the appointments. It's a lot of information, and a lot of people, especially elderly people, tend to have a lot of, I would say, like, what's the word I'm looking for? Misconceptions about hearing loss and hearing aids. Sometimes they come in thinking they cost like $20,000. Sometimes they come in thinking it's going to be like this huge, ugly thing that squeals all the time. People's fear about the unknown can get in the way of them getting the help that they need. And if they have the support of family, someone going to appointments with them to help, support them and kind of make it less scary, in my experience, that's really helpful. Also, it's important for the entire family to understand that hearing aids our aids, but we can't fix the damaged hearing system. So everybody needs to have realistic expectations about how the hearing aids will help and the things that we can't necessarily help. So if the family is present and everyone has that information, it can help them know how to use good communication practices with the patient to really maximize their ability to hear and their satisfaction and the family's happiness with being able to communicate with them.
Yeah. Well, thank you so much for helping us out.
That was so short, no problem at all.
Hi, I'm Julia, and I'm going to be talking about our therapeutic considerations to hearing loss. Something that needs to be considered is the schooling for the child. There's different options for everyone, and it's best to find what one works for the child and their specific case of hearing loss. Like, there are just schools for hard of hearing and for deaf, strictly no hearing kids. And that caters to their special educational needs, and it has the special equipment that you need for hearing, and they have teachers who are also deaf who speak sign language. It's just a more inclusive setting. Or there's just regular public school where the child who has hearing loss may need extra support in their classrooms, but they still have their in-class aides, they have nurses, they have special education programs, and they use an FM system, and that helps the child hear the teacher in the normal classroom setting. So an FM system is a frequency modulation system, and the teacher wears a microphone, child wears a amplification device. It definitely makes the classroom setting easier for a child with hearing loss. It gets rid of all the background noise. If the child is far back in the classroom, they'll get the amplification that they need to be able to hear and understand the teacher. But they are expensive for schools. They are small and easy to lose, especially in younger children. It could fall out or they could forget it and bring it home, and it's more costly. But if you are profoundly deaf and you're in a public school, an FM system is probably the best way to get your education that way. And different types of intervention or therapeutic options. You can get a hearing aid, cochlear implant, a BAHA, which is a bone-anchored hearing aid, or sometimes in rare cases you can get surgical intervention, which to try and help restore hearing. But most common is hearing aids, attaches to your ear and amplifies the sound. The cochlear implant, and it's surgically implanted on the bone, and it bypasses the normal auditory hearing process, and it replaces the normal hearing process with electrical signals directly stimulate the auditory nerve, where a hearing aid amplifies the sound. And a BAHA is kind of like a cochlear implant. It also is surgically implanted, but it uses your body's natural ability to transfer sound through bone conduction, turns sound into vibrations, which then stimulates your bone and sends vibrations to make you able to hear the sound. Even with all those options and treatment availabilities, out of 22.9 million older Americans who have hearing loss still choose to not wear hearing aids. What if medical treatment is not right for you? Well, it is still recommended that you visit an audiologist and get a diagnosis. And if it is really affecting your communication abilities and your speech, it is also recommended to see a speech-language pathologist and work on your communication skills. But if you're not interested in a hearing or wanting to get that therapy and those options to help your hearing, American Sign Language is a predominant way of communication. Instead of using sounds and their voice, they use their hands and signs, and that is another way of communication for someone with hearing loss. So, concluding thoughts about hearing loss. Not every person with hearing loss has a communicative disorder, but not every person with a communicative disorder has a hearing loss either. It's something to look out for, especially at the younger age, because it's easier to intervene at a younger age. The older you get, the harder it is to change your perception of sounds and make your hearing easier. So the younger you catch hearing loss, the easier it is to deal with it and be able to restore some of it. And you might need to see a few different specialists, an SLP, an audiologist, And not everything is just within one scope of practice, so it's important to know the bigger picture, so in your field you are able to help the best you can. And every person's going to be different. Hearing loss varies dramatically, whether it be type, severity, how it got accumulated, anything. So it's important to find what's best for a specific person, what will help them be able to communicate the most.